Thank you for joining our program tonight. And it's brought to you by the Just for the Health of It Health Initiative. And I'm going to let you all just go ahead with the program with Hackensack Meridian Health's Electra Willis. She is a master level clinician who is going to speak to you all about health and medical responsibilities for caregivers. Thank you, Electra, for joining us tonight. And thank you, everyone. I'm going to turn over the floor to Electra.
Good evening, everyone. My name is Electra Willis. I am currently a care coordinator in the social work department at Meridian Bay Medical Center, Hackensack, Meridian. So the agenda for this evening is going to be capacity and right to self-determination, nutrition in the elderly or those with chronic conditions, and the 5 principles of caregiving. So, as an introduction to this presentation, I'd like to say caregiving is the act of providing help and comfort to another person. It can involve many different activities such as grocery shopping, helping with dressing, eating, toileting, or providing emotional support to another person while they navigate a physical, emotional, or health challenge. So, who's the team when we talk about caregiving? So, of course, the team is the caregivee, the person who is being provided the care. The caregiver would be yourself or whomever has decided to take on the caregiver role. Of course, the medical team, very important. Other family members. Other family members don't necessarily mean that they have to be blood related. Family, as you know, is whomever it is that we choose to call family. So that could be close friends, it could even be neighbors. So these are the other people who would be involved as part of your caregiving team. And then, of course, the outside resources, which, again, very important. So some of those outside resources obviously can be entities such as maybe Meals on Wheels or a senior center or even some sort of like day program that may offer different types of activities for the person who is being provided care. So our first topic this evening is fostering self-determination as a caregiver. So when we talk about self-determination, we're talking about still allowing the person with whom is being provided the care the opportunity to make some decisions on their own, the opportunity to be able to say what they do want and what they don't want. It's not necessarily the caregiver's role to dictate those things to the person who is being provided care, especially if they still have what we call capacity. So if they have capacity, that means that we have to allow them a certain level of dignity, again, to be able to make some decisions on their own. So let's look at what promotes self-determination and assist in recovery. And when we talk about recovery, we could be talking about recovery from, again, medical or mental or physical disabilities. So as a caregiver, it may be stressful or worrisome to foster independence. Remember that the ultimate goal of being a caregiver is to help your loved one experience recovery. The more involvement an individual has in their treatment and day-to-day life, the more likely it will be effective. Self-determination promotes recovery, whereas making choices for your loved one merely provides maintenance from crisis to crisis. So there are times that you may have to make somewhat of a command decision. There may be times that something or a particular desire that the person who is being provided the care may want, and it may not be the best or the healthiest or the safest choice. So those will be times that you may have to really encourage the person who's being provided care and encourage them to maybe look at things from a different perspective, explain to them. And communication is one of the 5 principles that we'll talk about a little further down in the presentation. But so there are some times where you may have to make some decisions, but most times we're really trying to continue to kind of foster that self-determination. So find a balance that works for you and the individual you care for when it comes to decisions regarding their health care. So fostering self-control and supporting self-determination. So self-determination starts with little choices, which build the foundation for larger decisions. As a person starts small with choosing what to eat, what to wear, what hobbies to pursue, and what friends they may either kind of keep on as part of, again, the team, or it's just someone who brings them joy, you know. So allowing them to be able to do these small things will really help in building their self-esteem. It will help them feel like they are, you know, continuing to still be a part of, you know, just life in general. So as your loved one becomes more self-determined, support them in their decisions. Feel free to provide guidance, but allow the decision to be their own. Naturally, if the decision jeopardizes the health and safety of your loved one or others, you should intervene. Depending on the person you care for, it may be helpful to list options for them to choose from. As long as their decision does not endanger them or others, support them. Giving an individual the ability to choose and supporting their choices can empower them, boost their confidence, and help them feel proactive in their lives. So we can move on to topic 2, nutrition in the elderly and those with chronic conditions. The food battle, and I kind of named it the food battle because not only am I, you know, a licensed clinician, but I also act as a caregiver for my aunt who is elderly. And there are definitely times that there is a food battle. So let's look at that. So common dietary problems that the elderly may experience may include or be related to taste changes, swallowing difficulties, which we call in the medical field dysphagia, nausea, vomiting, irregular bowel movements, weight loss, malnutrition, dementia, and dehydration. Finding ways to overcome these problems will optimize the quality of the elderly. And so what I can say is that oftentimes what I see, especially in my field, is these very issues, the irregular bowel movements, the weight loss, the malnutrition, and dehydration. And oftentimes what happens is, as you know, especially as we age, there's times that our body doesn't necessarily signal to us, hey, I need, you know, I should drink water, or I need something to eat. So it's going to be these times that you will, this is one of those times when we talk about choice, right? Or options. You want to be able to provide certain options. If there's swallowing difficulties, maybe either working again with part of your team, which is going to be the medical team, to see if do they need a thickened liquid, you know, is that going to be something that's going to be helpful with them for being able to swallow and obviously not aspirate, because what happens is if the liquid is too thin, it goes into the lungs and it can create pneumonia. So these are reasons why, just making sure that their diet and what they're eating and what they're drinking are going to be appropriate for your loved one. Okay. So supporting the elderly or chronically ill with healthy eating habits. Similar to other life stages, caregivers can support older adults in achieving a healthy dietary pattern that fits within their budget, preferences, and traditions. And so oftentimes, of course, as diets have to change, sometimes those changes can become a little costly. So this is where some of the programs that are out in the community, such as potentially Meals on Wheels, or you can get in touch with the Office of Aging, who can link you with other programs that will help with possibly some of the cost. Maybe even Family and Children's Services. I know that they have a program like that in Monmouth County. I'm not sure if they have that in Middlesex County. But I'm sure that they have something very similar. And you can potentially, again, tap into these programs that will help with mitigating some of the additional costs that would come with a new diet. Okay. And some helpful tips are sharing meals with friends and family can increase food enjoyment and an opportunity to share their day. So I oftentimes, I think that maybe one of the issues or when a caregiver feels maybe even sometimes overwhelmed and it's just about, I need to get food in front of them. And they tend to sit them down at the table and, present the food. But sometimes it's not just about the eating, it's also about the camaraderie. It's about, can I talk to you? Am I able to, it normalizes it. It's you essentially are still kind of creating that setting where everyone used to sit down to dinner and kind of talk about their day, right? And so remembering that those little things are still very important to the person who's being provided care. Experimenting with different ways of cooking food from all food groups can help identify textures that are acceptable, appealing, and enjoyable, especially for those who are having difficulty chewing or swallowing. So again, if they're if the person who's being provided care is at the point where maybe they're no longer able to chew meat, or they just at this point have no longer care for a particular texture, then that's when, again, and we'll talk about it later, the communication comes in, where we talk about, so what are some of the things, and this goes back to the options again, what are some of the things that they would like to either try or, something new. Okay. Okay. All right. So topic 3, the 5 principles of caregiving, which is safety, dignity, independence, privacy, and communication. So let's look at the first one, safety. So that's always going to be number 1, right? As a caregiver, the number 1 goal is to keep the person who is being provided care safe, right? So that basically means preventing injuries while caring for others. Okay. Some of the ways to do that is to keep several flashlights and backup batteries on hand in case there's a power outage. Don't use candles because candles are obviously a fire hazard. Install locks that are out of sight. So oftentimes, especially if you have someone who may have an altered mental status, and they tend to want to go to the front door and open the front door and just walk out, right? Again, I can't tell you how many times we've seen that. We've actually had patients come into the hospital who were in that altered mental status, and either in the middle of the night or just when someone's not paying attention, they all of a sudden find that they're no longer in the home. And so now they have to look for them, right? And oftentimes it does tend to happen in the evening for some reason, and or early mornings. And so maybe installing locks that are out of sight from the person who's being provided care will, be more of a deterrent for them to just walk out the door. Okay, so now let's look at dignity. Dignity is the respect and value that everyone deserves as a human being. It means treating everyone with courtesy, consideration, and politeness, and respecting their choices, opinions, and beliefs, even if they differ from our own. So again, that just goes back to kind of the right to self-determine. Just because we don't necessarily agree with some of the things that they may want to do, as long as it's not violating the first principle, which is safety, then that's a discussion, right? That's something that you can potentially talk about. This is one of those times where maybe you have to find out what's driving this desire, what's driving this, reason for them to want to do a particular thing, and coming up with an alternative, right? If it just doesn't seem feasible. Okay, so number 3, independence. Success depends on a caregiver's ability to help the person they are caring for feel a sense of control and independence. This is accomplished by including the person in the bathing decision, encouraging independence, protecting the person's privacy and dignity, and practicing flexibility. So when we talk about that, we are specifically talking about, again, a person, for instance, let's talk about making the bathing decision. I know that there are times that my aunt doesn't particularly want to sit in her shower seat and take a shower. There's times that she may feel like, you know what, I don't feel like getting all the way in the shower. I just can we just do like a sponge bath or something like that. There's nothing wrong with that. Even if you feel like they need to take a shower, if that's not what they want to do, again, this is, allowing them the right to self-determine. As long as you are still providing the care and they're still getting clean, then that's a decision that they can make. They can make that decision for themselves. Okay. And as far as privacy, number 4, provide them extra privacy in overcrowded spaces. Look away while they're getting dressed. Maintain a personal space and boundary. Discreetly identify their pains and discomforts. Some people are very private about that. They don't want everyone to know that they're in pain. They don't want everyone to know that their knee is hurting today, or that they're struggling with, being able to get up and go to the bathroom. So it's about making sure that you are keeping those conversations discreet. That you're not in a crowded place saying, oh, you can't stand up, things like that. Because again, we're talking about, dignity and privacy, right? Assist them with using the toilet, of course, and maintaining patient confidentiality. So of course, if you are assisting them with going to the doctor and different things like that, you always want to make sure that you're keeping their health information. You want to protect that health information. It's not for everyone to know. It's only for those that they choose to share it with. And that even means potentially some family members. If you're the caregiver and they're saying, I don't want my sister to know, what happened at the doctor today. Then that's their right again, and as their caregiver, you should really respect their right to privacy and confidentiality. And so communication, the big C, which is really across the board, which is the most important thing about the whole caregiving process. So that's number 5. Okay, it's good to set a goal of sharing and being open right from the start. Remind each other that you're on the same team. Share your fears and your worries. Be honest. It will also help you keep supporting each other and reduce stress and anxiety. Acceptance and sharing will help keep your relationship strong. So, of course, when this particular bullet point, when it's talking about, being able to share your fears and your worries. I mean, of course, if you're caring for someone that has a chronic illness or something like that, when we talk about sharing your fears and your worries, we aren't necessarily talking about you saying, well, I just can't really imagine you having to go to chemotherapy every day. I can't, that radiation is doing, it's just really doing a number on you, not that type of sharing, when you can share things like, just how you're feeling about the whole process along with them, because obviously if it's scary for them, it's scary for you, whatever that may be. Transparency and just being open is definitely a key part in the caregiving process, and it will be appreciated. It really will, not keeping secrets, not having side conversations with the doctor and or the family members and not including them, if it's about them, they have the right to know. Respect your own feelings, needs, and desires, as well as those of the patient or the person who's you're caregiving. Speak out about your feelings while being thoughtful about others' feelings. Try to use I statements rather than you statements. So I'd like to actually move to the next slide because that's one of the last bullet points I think is very important. Okay. So in summary, family caregiving affects millions of Americans every day in all walks of life. Remembering the most important skills to have will be key. So communication, as you can see, is at the top of the list. While it's hard to pick the number one most important caregiving skill, communication is a good contender. Patience. Patience is a virtue, especially for caregivers. There are times that I am sure that the person who is being provided care can be very trying. There are times that I'm sure if you are tired, if you haven't gotten a good night's sleep, if you're hungry, all of those things can wear very thin on your patients, right? Also problem solving. If situations come up, again, communication, it's about problem solving. Problem solving goes back to the whole team. Problem solving starts with the person who's being provided the care, you, the medical team, your outside support, as well as your resources, right? All of these people are part of the problem solving, okay? Remember to always display empathy. Not sympathy, but empathy. I can tell you that most people who are, in a compromised either health or either physical health, mental health, or emotional health situation are not looking for people to feel sorry for them, but they are looking for people who can understand and empathize. with what they're going through. Try to stay as positive as you can. Oftentimes in caregiver roles, it's very difficult to maintain positivity, especially if there are chronic conditions. So finding, that bright spot is always going to be so important. And the last point that I'd like everyone to please, please, please really take heed to is the self-care. As a caregiver, self-care is so important. If you are not taking care of yourself, there is absolutely no way that you can provide care to someone else. So if you are not regularly getting sleep, eating properly, doing something for your own mental and physical health, taking some time away from the person who's being provided the care, obviously you're going to set up some responsible alternatives where they will still be provided care, but for yourself to be able to kind of separate from that is so important. Taking care of your own health, making sure that you're making all of your own doctor's appointments and different things of that nature are also going to be very important. Again, if you are not well, then the person who you are providing the care to will not be well. And so I wanted to include some resources. So the Middlesex County, NewJersey.gov, community, the Office of Aging and Disabled Services and Nutrition Services, great resource. And actually, even though these two links are the same, they open up to different things. And then there's also this other link. It's the caregiving and GAD source. So that's a great link. And Emblem Health, even though that's obviously like an insurance company, but they have some great I want to say links that will be helpful for people who are caregivers. Great links for support, great links for self-care, different things like that. So I'm gonna, if you can leave this slide up so people can take down this information, that would be great. But for the most part, that does conclude my presentation. Okay.
And what we're going to do is, if anyone has any questions online and in person, we'll go ahead and do the Q&A right now. Just enter your questions into the chat. We have one question, Electra. It says, how do you best deal with dehydration?
Okay, so dehydration, again, is probably one of those big ones, because oftentimes, especially the elderly or the chronically ill or those who have altered mental status are not, their bodies aren't necessarily signaling to them that, I need to drink, I'm thirsty. So it's really about just making sure that you are providing some sort of beverage, preferably water, or some type of unsweetened juice is probably going to be best, because sometimes after a while, it's just kind of like they're not drinking because water has no taste, even though we know water is what's going to best hydrate you. If you can find something that is low in sugar, but still has all of the necessary properties for hydration, then that is going to be the best bet. And honestly, just kind of offering them the beverage maybe every 2 to 3 hours, and trying to get them to drink at least about 8 ounces, 6 to 8 ounces is going to be, you know, the best way to try to mitigate dehydration.
All right. Well, thank you everyone for attending, and thank you, Electra, Willis, again for giving this wonderful presentation for caregivers.